And
Yeah.
what are the benefits of apprenticeship for employers?
Yeah, so when we looked at the data, there's a couple of benefits that really stood out. So one is retention. So that retention, those retention issues, because somebody, for lack of a better word, grows up in your organization, you really have that opportunity to build over the year of that apprenticeship through mentorship, through different experiences throughout the organization, where people can really find that place. A typical apprentice might connect with different in different clinical settings, so they can find a place that, oh my goodness, this clinic out in Issaquah is that these are my people. This is where I really belong, right? So that retention is really important. The other thing we found too is that the people that work for the organization already that got to serve as mentors, so those existing medical apprentices, found huge value in that work. All of us really want to advance in our careers or do different things. The opportunity to share and the opportunity to teach others and to feel like you're passing on to the next generation is a really important value add that is there. So those are really, I think, two components that really jumped out to the top. And then we can really kind of attach some actual ROI to that in terms of retention and churn are key drivers of financial performance. I think another thing that we're still struggling to quantify on the financial side, but is really important, is that apprenticeship allows employers to recruit a much more diverse workforce. So actually having representation at their skilled provider level from communities that they're providing health services for. And so we're still working through some of those about how we can actually quantify that from an accounting standpoint. But I think we can all agree that from a mission standpoint, from a value standpoint, that aligns with many of our healthcare providers.
Yeah, definitely. That's fantastic. And so, how do you calculate the return on investment for
Mhm.
employers for apprenticeship?
Yeah. So the work that we did really tried to look at what the costs were and then what the benefits. So there are costs to doing apprenticeship. And what we did is we did a comparison between a healthcare provider that would hire an apprentice on day one versus hiring someone that already went through 2 years of school at one of our amazing community and technical colleges. And so clearly starting with somebody on day one is they're not going to be able to provide as much value right out of the gate. Right. So there's some cost for training, whether it's formal academic training, there's cost of the mentoring. You've got to have a coordinator, right, to be able to coordinate all those things to ensure that the experience is really meeting those high standards for medical professionals that medical assistants truly are. So there are definitely some upfront costs. And if you just look at year one, if you hired one medical apprentice that came out of community college and one that came out that's starting as an apprentice, the medical assistant with 2 years of academic experience is going to provide a greater value the first year. But by year three, those tables turn. And that's because then we start to look at the benefit side. And so when we look at retention is the largest driver of that. So we talked about already how that apprenticeship component can really help somebody find their place within a larger organization. They're really kind of growing up and learning within your particular organization's culture, aligning with its values and mission. And so that the retention numbers are the largest driver of that benefit. Um, I think it's important to note too that an apprentice, while they may be start a little bit behind that first year, the person who went through the medical assistant program, they are still providing value. So they're still going to be seeing patients as they move through their apprenticeship and they get through that. So they're actually going to be providing service and generating revenue for organizations. So it's not like you're taking somebody for a whole year that provides no value. It just is a little bit of a different slope or a little bit of a different turn over time.